So my name is Michael Moloney and I'm an associate practitioner and also a nurse apprentice within the trust. So growing up, I always wanted to go in the army, be a soldier. So obviously prior to my time in the trust, I served with the Royal Engineers and also the Royal Army Nursing Corps. So that's what I did before I came into the trust, yeah. Well, when I was in the army, I was living in Germany. So obviously I started a family with my partner, who was from Teesside, and the time was right to get out of the army. So obviously I left the army and looking for work around the Teesside area. Wanted to be part of another service, like being part of a team, and I thought the NHS would be a good choice and see some jobs for Tuve, working in our children's services. And I started on a bank, so I started on the Trust Bank before I got some full-time employment. Then I managed to get a Band 2 post. And I think over the years I've been in every banding. I think I've Band 2, Band 3, Band 4, and now I'm on the nurse apprenticeship for the Band 5 role. So at the moment my role's split over, like, I would say 2 roles really. So I'm an associate practitioner in a children's intensive home treatment team. It's a community team and we support young people with an intensive approach in the community with a view to reduce or take away the risk of admission. So we work with children and young people and their families. But also I'm on the Trust's nursing apprenticeship programme. So I'm kind of split the 2 really. So I spend time on placement with the different teams in the Trust and time at university. Then I'll go back to my substantive role for camp blocks where I will go back and just carry on as a support worker really. Best part of my job. I think I'd be here all day if I told you every single thing, but if I'm being honest, it's probably the difference I feel my team makes with the young people and the families. I mean, the young person's always the main focus, but we support like parents, siblings, grandparents, whoever the caregiver is really. And to see like that impact across the whole family and that improvement, that's one of the motivators. That's one of the main reasons why I enjoy coming to work and what keeps me motivated. So we're a community-based team. Yeah, we offer community support. So like I said, the main aim of our team is to offer intensive support to the young person and the family with a view to reduce or take away that risk of hospital admission. So basically try and give them the support in the community, keep them at home with the family. So we go to the home, we might take them out in the community, do some community support, might go see them at school, just depends where the need is really. But we offer elements of therapies. We do kind of work around anxiety, we work with young people with depression, we work with young people who are experiencing unusual kind of sensory experiences. Yeah, so we do a wide, varied piece of work with young people and families. It's really good. Yeah, it's been really good. I think I've been with the Trust, you lose count of the years, don't you? That's a good sign, I suppose, isn't it? I'm not counting days down. But I think about 12, 13 years I've been with the Trust. And I started in the bank, so I wasn't a full-time member of staff. But I got a job as a Band 2 healthcare assistant. Then I was supported in doing my diploma, so my level 3 diploma. Then I got supported on the Band 4 apprenticeship programme. So I practice as an associate practitioner. That's my role now. And more recently, in the last 2 years, I've been supported on the Band 5 apprenticeship scheme, so the registered nursing degree apprenticeship. So yeah, I've been supported all the way through my career really. I've had good managers all along the way and I haven't wanted for anything really. I couldn't have left myself and I couldn't have done it financially. I've got a young family, so I feel like I'm really privileged. So it's been really good. Yeah, when my times, I do blocks at work, so I might do a few months at work or a month at work. Then I'll go off and do placements with other teams in the Trust and I'll study at university. So my support worker role, obviously part of a small team, we're a nurse-led team, but we have psychology as well. So we'll go to work, we'll have a morning huddle, like today's business, speak about who we're going to see today. Then we'll just go out and kind of follow our diaries, go see the young people, do our pieces of work. We'll come back and we always feed back to the team and kind of let everyone know what's happening with the young person, just so we're all aware really, because obviously there'll be days when I'm not in, so someone else will have to take over my role and at least they'll know or they'll be updated on that young person. Yeah. University, like I say, as any other student would be, I would just go on placement with different teams, get different experiences in different departments, in adult services, learning disability services, elderly services. So I've covered every area within the trust. Obviously I'm in my last year of university now, and I'll go to university and do kind of what a normal student would do in terms of lectures and the academic side. So it's wide and varied. Yeah, sometimes I come back to work and I forget I'm a student, but then I go back and I forget I'm a support worker. So, but it's good. It's a good experience. It's a good way. It's a good path into your nursing really. It's just time management, and the university's been really supportive as well. And I think the apprenticeship scheme, it's built differently than the normal pre-registration course. So I think they do factor in kind of some of the students will be a little bit older and bolder, and they're just really supportive anyway. And the trust's been dead supportive, training department's been dead supportive as well, and my manager's really supportive. So like I say, I've had no issues yet, and I'm sure I won't. I'm sure I'll be fine. I would say 99% of people who work in care really have probably got the same mindset, and I just think a lot of people think if they're a little bit older that it's too late to go to nursing, but you know, I'm 42, I'll be 43 when I qualify, so I didn't start my nurse training until the last 2 years. I don't think you can ever be old. I don't think you can be too old. I think you would probably bring a lot more experience into the role. So yeah, just go for it. For me, I think it's respect. I think first and foremost, you need to respect yourself, and you know, you practice what you do as a nurse. You need to respect that, respect your service users and your colleagues. And I think if you do that, if you have that respect, I think the compassion and responsibility will just come anyway. What I love about CHUV is the way I've been supported over the last 12 years. I really do think I've been supported, you know, really, really well. And I think if I did problems or any problems with my training, work, home life, I think they're an approachable trust, and I could approach them without any issues. And also how diverse the trust is in terms of the staff members they employ. We're a big trust, we've got a big client base, and kind of the services we offer are really diverse as well. So yeah, they're the reasons.